We now move on to health, where a total of 32 new suspected cholera cases have been recorded in the country, and Harare is deemed the epicenter of the outbreak, with 31 of the 74 hospitalized cases. Acting city epidemiologist Michael Vere says averting the situation takes careful following of precautionary measures.
We now have 96 cases of cholera. Of these 96, 27 have been confirmed. And if you remember, this outbreak started on the 24th of April. So it means the cases are increasing rapidly, which means people need to take precaution so that we avert the situation that we witnessed in 2008 and in 2018. So at the moment, the most affected area is Glenview and Budiriro. Initially it was Budiriro that was most affected, but the epicenter is now shifting to Glenview.
On Tuesday, government said it was finalizing research on the cholera vaccine, set to be rolled out soon.
Cabinet is informing the nation that a cumulative 86,486 suspected cholera cases have been reported on the African continent, with 1,213 deaths, reflecting a case fatality of 1.4%. Zimbabwe has so far recorded 722 cases, with 669 recoveries and 5 deaths, reflecting a case fatality rate of 0.69%. Only Matabele North Province remains unaffected by the cholera outbreak. Cabinet wishes to assure the nation that the cholera risk assessment, which should guide the application of the oral cholera vaccination, has been completed across all the 10 provinces. Active surveillance of points of entry and exit is continuing as part of a multi-sectoral approach in response to the cholera outbreak. Government is availing funds in order to bolster the country's response.
We are now joined by Harare Institute of Public Health's Dr. Amos Marume to understand the current situation better. Good evening, Doc. With the escalating cases, at what point must the country consider declaring a state of emergency?
One case is one case too many, so I'm sure the government is on high alert and is monitoring closely, these cases, and I'm sure at this point probably there are cases being reported in virtually every province now. I think given the 2007-2008 experience, we may do it much better this time in terms of things like quickly ensuring that people have access to water, people have access to oral rehydration salts, people have access to healthcare facilities.
Now, you mentioned the 2007 and 2008 outbreak. What lessons can we learn from that period where thousands lost their lives?
2008 gave us quite a lot of lessons. The encouragement again is the data. We could learn more from the 2008 data if the data was somehow made digital and available to scientists like ourselves. We could at least predict one or two things and maybe come up with conclusions that would help our responses from now going forward.
Now, still on health, a shortage of health workers at Bulawayo municipal clinics has left the city exposed in the face of the cholera outbreak. This follows a mass exodus of nurses lured by better opportunities. In the following report, ZTN's Andile Chuma gives us residents' concerns and possible solutions.
While the mass recruitment of health workers helped the Bulawayo City Council, the staff turnover continues to be high, and council clinics are operating at 60% capacity. This week, the city's Health Services Department advertised 50 vacancies for registered general nurses. Bulawayo Progressive Residents Association chairperson Ambrose Sibindi said skills drain had negatively affected the residents.
the patients, they outnumber the staff. And when we are seeing this exercise or this advert, I think it's going to assist, it's going to be a relief to most of these patients, because when you are a patient, you need to be attended to quickly, and you go and rest because already your body is not in good standing.
Clinics have been overwhelmed by the high numbers seeking service. He called on council to improve the working conditions of nurses in order to retain them.
I have seen these adverts regularly. I think this is 5th or 6th time when council is busy recruiting and nurses leave. That's a challenge. So this is just a temporal measure. I think we need to address the core issues. To say that these nurses, there must be a way of trying to retain them. How? By talking to them, negotiating with them, giving them the information that they will make sure that they don't run away.
Secretary for Administration, Tembelani Dube, said the shortage of critical health personnel was critical at a time cholera and other waterborne diseases are wreaking havoc.
Even the efficiency of attending to those people is compromised compared to the past, what was happening. We knew that our local authority clinics were the best service providers in terms of health facilities.